folks have flights to catch and trains to catch. If we could get started. Thank you. Thank you. Okay, so the second session is designed as a working lunch, so don't worry about crunching and crinkling and stuff because everyone else will be. So I'm gonna get right to it. I sent around an email earlier that said that I wanted to start it off this session by polling you about what you folks are hearing from your clients in terms of their private market housing protections being protected. So that's like being able to get their security deposit back and being able to terminate their lease early. And again, this is a private market, not HUD-funded public housing. And as I said in my email, I've heard responses from all over the spectrum, so I don't necessarily want to devote an hour to this. I just want to get a sense of how big of a problem this is so we can kind of assess how much time we spend on it. So if anyone wants to jump in and tell me whether your clients are receiving their private market protections, please let me know.
Hi. In Butte County, we're fairly successful when we've had to relocate somebody in getting early lease terminations, et cetera. Yeah, it's working pretty well.
Okay, great.
Security deposits, maybe not so much.
So what happens when they can't get their security deposit back?
Well, usually, excuse me if there's any landlords any private landlords in the building or at the meeting. Really, it's just, and I live in a college town, so we live in a college market, and they're it's very punitive in terms of moving out and the state of the apartment and or housing when they move out, because they're used to working with some maybe young people who have great fun parties at their house. So it's just really rough to get a security deposit back in full, back in some hopeful amount of high percentage. It just really is. Obviously we work with folks on that, and we have some really solid relationships with some landlords, so we're able to do some advocacy as well as fund some repair. But it's an issue. But I really have to think that that's a lot to do with the market that we have.
It's Elizabeth. Hi. So I think that, it's a much bigger issue than we know, because we only know about those survivors who actually bring the issue to us. And I think since we've started providing rental support to survivors, we're seeing a lot more landlord-tenant issues that we're dealing with. And so when we bring to the landlord or the property owner kind of the rights that survivors have in the state, then they'll back down. But if there are survivors out there that are, don't have the support of these types of services, they're not being helped, and they may not know their rights. So I think there needs to be a lot more done around advocacy, even just providing information about protections more widely in a way to ensure that survivors who are not connected to services are still know their rights.
I think it was tailored than this.
Hi, Taylor Jenkins, Dylan College Project. So we work with people throughout the state, and security deposits is one of a higher issues of what I get PAs about, the technical assistance that folks are calling and needing assistance with. And this is also true for National Housing Law Project. They also receive a lot of issues with this. And as what happens, as someone who used to represent tenants in eviction and a lot of housing issues, generally the clients, if the landlord doesn't want to give them the security deposit back, which often happens, they have to go to small claims court. And security deposits is one of the top issues in small claims court. So not just for survivors, but for everyone in terms of getting security deposits back. My understanding from the technical assistance questions I get, Security deposits are particularly difficult to get back when survivors are terminating their lease early. And so obviously that is something that's specific to survivors.
So the caveat in this is that if we helped place the individual in housing, then our continuum of care set aside some of last year's HEAP money for a mitigation fund. So it's a maximum of about $3,000 per unit, and that's across all homeless services. But it's been a very good incentive for landlords to work with us more openly because we can do repairs and then get their deposits back. And so that's been very helpful. It's also been a really good carrot to be able to say, hey, if anything happens, we can help fix it. And so we're able to get people placed with that.
I also just want to, I know we're going to talk about domestic violence housing first funds, but that, you know, has helped, I think, with these issues in part because we've always worked on housing issues, but because we're doing things like paying people's rents, you know, their deposits, et cetera, we are, you know, in the mix a lot more and so able to do more of that education. And I just want to say that with my agency's domestic violence housing first funds, we hired a case manager, I think like most folks have with that funding, but we also hired a lawyer. And, you know, part of it's we have lawyers on staff, so that's our thing. But we found that we were able to negotiate obtaining a lot of those security deposits back with our in-house attorney. But as I'm sure you all are aware, legal services in general is, you know, there aren't enough lawyers, et cetera, et cetera. So that's one of the other issues is that when, you know, negotiation could help, there aren't enough lawyers and or, you know, there just aren't even enough advocates. But that domestic violence housing first money has been really helpful in this area.
Well, oh, sorry, Jana, did you have a follow-up question?
The model that you're talking about, which requires the deposit back, indicates that somebody's moving out. Why is it, and this is from a naive question, but why isn't, say, the organization renting the apartment with such a high need for housing? If someone moves out, you move someone else in. Then the security deposit is not really the issue because you're not necessarily leaving. There, you know, the person's different, but the organization's the same, and the organization's rented the apartment. So,
Well, sorry, go ahead.
I'm just.
I think this is a good segue to domestic violence housing first, where keeping people in their existing homes when it's safe, I think, is a high priority. So I'm sorry to interrupt Chris and Gabby's meals over there, but if you'd just be willing to share with us what you've learned through your evaluations, both in California and other states, and maybe give a brief introduction to domestic violence housing first for folks who know less about it, that'd be awesome.
We actually have an infographic that we created for this meeting for you to get a sense of the recent evaluation that we conducted here in California. So I'm going to pass these along as I start talking. Oh, and I'm Gabby Lopez-Cerrone from Michigan State University. So the domestic violence housing first model is aimed at supporting survivors to obtain and maintain stable housing, and it has 3 different prongs. So it's the use of flexible financial assistance, the use of mobile advocacy that is survivor-centered and trauma-informed, and then the development of community relationships, especially with housing providers. As some of you know, that might be very difficult as you're talking about some of the difficulties of engaging with landlords and housing providers that can be difficult for survivors to navigate. So that is one of the pillars of the model. And so we first conducted a process evaluation in California with the pilot programs that were part of the initial pot of money that Cal OES allocated for the implementation of the model. And so there were 8 pilot programs, and 7 of them participated in a process evaluation where we interviewed the staff and tried to figure out how they were implementing the program, and some preliminary data around the impact of the program. So we had client feedback surveys that were adapted to measure this. And then Cal OES funded another batch of programs that a lot of the programs here might be represented. I think it's the KDs. And there were 33 programs that were now funded to implement this model. So Blue Shield of California, who had funded the process evaluation, was interested in funding an evaluation of the outcome of the model. And so we did a multi-prong evaluation so that we really wanted to explore the different parts of the pillars of the model. So we had adapted a Google sheet, an Excel sheet, where programs could track the use of the flexible funding that they received as part of the grant, and they tracked every payment that was made for survivors so that we could understand what was this flexible money being used for. And we then also had the programs, we trained them to use the client feedback surveys that were developed at the process evaluation so that it could also be disseminated, and we collected that data and looked at it to see from survivors what was the impact of the model, how they perceived it was going. And then we also, with Rainbow Services and our partnership with Elizabeth, we did a longitudinal evaluation because we had learned from the process evaluation the first year that Rainbow Services was implementing the model in really fantastic ways, and we wanted to see what was happening with survivors. So now we were able to interview survivors that had been in the program for some time to see what it needs, what were their needs in order for them to maintain their housing. And then we also were really interested in understanding more about the community relationships. So we contacted Rainbow and their housing team to talk about how they developed relationships with housing providers and other people in the community, and also tapped into those community members to really explore the nature of the relationship and why they remain engaged with a domestic violence agency that provides these services, especially in a housing market that's very, very tight. We then also, in the process of doing this, were connected with News, which is another organization, and this organization is in Napa. And we went and did a few interviews with community partners and their staff around their implementation of the model, because they were also highlighted as an exemplar. And so that is, the evaluation has a lot of different parts, so we thought that maybe having like a one-pager that you could see all the different parts was going to be helpful. Do you have anything to add?
About the evaluation?
Yeah. And so there were a few just really, really interesting pieces around this. I think one of the things that was really key and a difference between what we learned in the process evaluation versus the second evaluation that you have in front of you is that in the process evaluation, speaking about the flexible funding, a lot of the funds were used for rental assistance, and that makes a lot of sense in a reimbursement model because there weren't a lot of guidelines of what would be reimbursable and what would not be. And so working with the partnership, we learned that programs really wanted some kind of like guidelines from Cal OES to make sure that if they were going to allocate funds and pay for things for survivors, that they were going to be able to get those funds back and be reimbursed. And so for this second year, we all worked really hard to get some kind of general guidelines, because part of it is not having a lot of clarity from the federal funder on what is going to be reimbursed. So there's a lot of different parts of this, but we got some more clarity, and programs were amazing in being able to use this funding. Of course, rental assistance is a really big need. So somewhere, I don't have one in front of me, but somewhere around like 60-something% were still used for rental assistance. But the rest of the money was used for a wide range of needs that are critical for maintaining housing, for safety, changing locks, some education, like a lot of different things that really help survivors maintain their housing and have stability. Employment, things that they need that traditionally other housing programs would not, that wouldn't be able to help. And then with our evaluation with Rainbow and working with survivors, and by the time that we started interviewing them, they had already been housed. And so then we were really interested in knowing like what they needed to maintain their housing. And a lot of very client-centered services were really necessary because their needs were very varied. But and despite the wide range of needs that the survivors in the evaluation talked about, they all mentioned that they were able to have their needs met by the housing team at the organization because they were providing survivor-centered services, and that was really critical for them. It was also really interesting for them that they really were interested in a lot of the social support after the fact, after they had been housed, because a lot of the times, and this is a very common experience across the country, is that there is so much need for housing advocates. So it's about getting people into housing, and then there's somebody else who needs housing, and people don't have the support after the fact, where a lot of things then come up for them, and that can be destabilizing. And so one of the things that was really helpful to hear was about the importance of that follow-up after they had been housed and support after they had been housed that really contribute to their stability.
Great job. So I'm Chris Sullivan from Michigan State University, and the two of us are working to do a lot of evaluations of the DV Housing First model, and I wanted to just give you a little bit of an overview of why it was developed and why it's so important. And I think the key piece of DV Housing First is its flexibility. So it was really set up so that you didn't have a cap of this is how much money I can give you, or this is how much I can spend, and this is when it's going to end. This was really started by the Washington State Coalition Against Domestic Violence with Bill and Melinda Gates Foundation funding. So because it was private funding, it was really flexible, right? I mean, they could spend it on anything. And they had done an evaluation. It was getting a lot of national attention. And so then when OVC had all of this influx of VOCA dollars, California actually was the first state that the state said, we're now going to use this for the DV Housing First model, which was very exciting. But of course, it's state dollars now. And so I know all of you are realizing that, governmental dollars are not going to be quite as flexible as Bill and Melinda Gates Foundation dollars are. So that's one of the things we're looking at is it's still flexible, and the flexibility is critical. It's certainly not as flexible, and some of the programs, I'm sure you have great examples of needing that public-private partnership so that you have the private dollars to spend on the things that maybe the government isn't going to understand the importance of paying for. We are doing a really large longitudinal evaluation in Washington State right now about this model, but I can tell you what we're finding is the flexible funding is huge. To be able, not just to help people get housing, but to prevent homelessness in the first place. Having worked with a lot of domestic violence programs in a lot of states for many years, I can tell you how common it is, and many of you know this too. We have a lot of people on the phone of the DV program that when somebody calls up, they immediately just want to get them into shelter. And how destabilizing that is for people. They don't want to go into shelter. They would want to stay in their homes, but they don't know how to do it safely. And this money can be used to help people stay in their homes safely. So that's a very exciting part of this money, and we found even in the California project how many times it prevented homelessness from happening in the first place. And then the mobile advocacy is also a really key piece. And that's about getting out into the community. That's about not having survivors come to our agency or just giving them referrals, but having advocates taking them places, which many of you in rural areas have been doing for many, many years. But going out and working with people in their homes and in their communities and really walking side by side with them. And that's what we're hearing from the survivors is so critical. It's not just what they're getting, but how they're getting it. And they feel supported, and it really seems to be making a huge difference. So we are just so excited to have been part of this with California, because you really have been a leader in this. And I think a lot of other states now are looking to you and what you've been doing, and I hope that more are using their VOCA dollars in this way, as well as trying to expand and think about what are other state dollars, federal dollars, private funding, because we really need that private-public partnership. So we'll stop there and see if you have any questions, or we also just love to hear about your experiences.
I just want to also, one thing to note on your infographic that I think is one of the most exciting findings about the use of flexible funding is that we worked with 19 of the 33 agencies that had been funding, so they tracked over $3 million, and they worked with about 925 families, and 58% of those were able to use the flexible funding to prevent homelessness. I think that was probably, if I would have one finding to highlight, would be how exciting that is.
Hi, I think there's a few things that I want to lift up, and it's been an amazing partnership to work with Chris and Gabby, and also to be supported by Blue Shield. I think that that's a great example of public-private partnerships, and from the get-go, when we were initially funded back in 2016, I approached Blue Shield and said, we really need to evaluate this from the beginning. And I think one of the things the state could do better is providing funding for evaluation, because this is really building the evidence of a model that is working really well. I know for Rainbow, we've been able to serve more than 100 households with this funding. Those are 100 households that would have been homeless or in our very costly shelter. And I think it just really promotes the need to have a whole continuum of housing, from shelter for those who do need to escape a very dangerous situation, but it's been a game changer in how we think about keeping people safely housed in their own homes. It's really necessary that if we could evaluate and make sure that people are safe to stay where they're at, it's a lot less costly and it's a lot less disruptive to the family, and they get to stay, with their support system. So that's really an important piece. And I also want to thank Cal OES for the autonomy that they give us and how we run our program, and making sure that we are, utilizing those three pillars: the flexible funding, the mobile advocacy, and the partnerships. But for the most part, they allow us to just do it. And that's rare, I think, from a government funder perspective, not to have to go to them and say, we're going to spend $12,000 on this family. And so we're advocating as a field in Los Angeles to use state HAP funding, the homeless funding, to implement this model, but I am worried that our city and county regulations are not going to be as flexible. So if there's any way that we can influence, maybe not this year, maybe the following year, for the state homelessness funding to expand Cal OES's ability to either fund more organizations or give us more money to the organizations that are already running this, I think that would be great. Because otherwise, we do use rapid rate housing funds for our continuum of care, local housing dollars to help people, and we try and go that route first, but we know that those things are time limited. So we tend to help families or households for up to 24 months. And so the first half might be through rapid rate housing and then the DV housing first. But what we're seeing is more and more people need longer term support. I'll stop there.
I just have a follow-up question for Cal OES, actually, and then we'll go to Richard. So for Janine or Aaron M., I'm wondering, was it easy to get the authorization to be flexible with the Domestic Violence Housing First funding, or did you have to convince the legislature and the folks higher up in your organization?
I will have to say that I have to give the credit to that to Ricky Hammett, who was the DV unit chief at that time, and Lee Bills, who was in the position that I'm in at this time. I was in the agency, but I didn't work in this capacity, so I didn't hear anything about it, so I don't think it was a struggle to get it passed and to implement it. So I can't take the credit for that, but I do. I learned about the program. I've been in this position for a year, and before that, I worked on the sexual assault side of the house for most of my 20 years with Cal OES. But this was one of the first programs that I did learn about when I got in this position, and I really like this program, and I really love the flexibility in this program, and it has increased from 33 subrecipients to now 66.
And Crystal, if I could just clarify real fast, the funding for this, although it's administered from Cal OES, comes from VOCA. So the state legislature didn't need to approve the flexibility. The challenge, VOCA updated their rules finally after quite some time. And so there was some challenge of getting rules updated and then clarity from the feds. But that I think was where some of the clarity and the question of what can we not do with the money has come in.
Hi, Richard Thomason, Blue Shield of California Foundation. Just want to thank Chris and Gabi for all their work on this evaluation. It's really been a privilege for us to support Elizabeth and the field and the researchers in evaluating this program and really lifting it up now. And so I think with these evaluation results, we're very excited, frankly, that you all at the Little Hoover Commission are having this conversation and are interested in learning more about the DV Housing First program, because we think with your attention, with the field's interest, with these evaluation results, this really is a great time for us all to be thinking about how important this program is for preventing homelessness and addressing this problem, which has just grown so explosively in so many of our communities in the last several years. So with the legislative and governor's interest in homelessness, we are really interested, I think, in working with all of you to make sure these results in this program is front and center as one of the pieces of the solution to this important puzzle, which will take up a lot of attention this year. But again, really thank you for your attention here and look forward to working with you more.
Can I see a quick show of hands of how many people here their organization is receiving DV Housing First funding? Okay, and can I see a show of hands of anyone who wanted DV Housing First funding but didn't get it? Okay. Thanks. I think, was it Dion had a question? Or okay, sorry, I thought I saw Mike go on over there. So, if I understand it correctly, and maybe Krista and Cal OES and the other folks who really have a handle on this funding, because DV Housing First funding comes from VOCA funding, and VOCA funding has been high in recent years because of the Volkswagen and other multi-billion-dollar settlements. What's going to happen when that pot of money runs out with respect to DV Housing First?
Janine, you want to take this one?
I think it goes without saying, if the money's not there, there's only so much we can do, unfortunately, just to be frank. We try to keep some funds, and we try to keep programs going as long as we can. That's about the best I could say. But if the money's not there and we don't know, and we're happy every time we get our solicitation from the federal government so that we can keep some of these programs going or all these programs going, and we don't know.
So VOCA money is not set to run out at any set point. So the VOCA dollars are included in the Commerce, Justice, Science appropriation bill by Congress every year. So Congress sets the amount to come out. As you indicated, Crystal, it's not taxpayer dollars. It is funded by basically white-collar But what that requires, of course, is that the Federal Department of Justice criminally prosecute and successfully secure these settlements. When the big increase in VOCA happened in 2015, the VOCA fund had accumulated a balance of over $12 billion, and they were letting out about $750 million per year. And so the number of what was coming out to the field of crime victim response versus what was going in was far out of whack. So when they jumped it up, frankly, they jumped it to what the advocacy community had been asking for, which was about a rolling average of what was coming in as deposits every 3 years. Which is a sustainable place for them to keep VOCA appropriations. Right now, what we have seen, the federal level is a trend in the current administration to address white-collar crime through civil response instead of criminal, which means far fewer deposits into the fund. We're working really closely with our national partners on some legislative advocacy to look at updating the underlying VOCA statute, which was written in the 1980s, so that those civil deposits could be addressed. But I think it's both a mix of what the administration's priorities are and what the underlying statute says. But every year, Congress gets to pick how much comes out of that fund. And I just want to be clear, we have not gone through all 12 billion. There is still more coming in, right? Like, there is still more VOCA money. And what I really want to appreciate about Cal OES is when the VOCA dollars come to the state administrator, so Cal OES for us, has a 3-year time period in which to spend those dollars, which means the 2015 dollars didn't need to all be expended until 2018. And Cal OES was very smart in 2015 when we got the news of how much it was increasing, and like I said, I thought it was a typo. And they didn't send all of that money out to the field. First of all, I don't know how you all would have responded to that many RFPs all at once, but they very smartly held it back. And I believe right now most of the grants, if not all, are still on FY18 VOCA dollars. FY19's been appropriated, FY20 has been appropriated. So there's still continuity and process, and Cal OES consistently, I think annually, pulls together a VOCA task force that includes stakeholders from all the crime victimizations impacted by VOCA funding to reassess priorities, see where there's gaps, see where there's more needs. So I would imagine there might be some hard conversations coming because VOCA appropriations are going down and the deposits are going down, but also a lot can change in the next 2-3 years, as has changed in the last 5.
Can I just ask a quick follow-up question? I don't mean to jump in, but so obviously we're talking about VOCA money for Housing First. The state could fund
Yes.
housing, and was there any request to the legislature and the administration for money aimed at Housing First?
So I think you're reading the mind of the draft budget request document that's sitting on my computer. It needs to be finished. But that is going to be, I will say for the partnership, one of our big priorities this year will be securing some funding for the range of DV housing, so DV Housing First, transitional housing, shelter, and some of the COC money.
Okay, and then my other follow-up question, and I apologize if somebody answered this already. I think you said that it's now been expanded from 33 to 67 organizations, something like that. Okay, and I find the evaluation by the Michigan State folks to be really interesting and useful. Is that continuing as you expand the program, or is somebody still evaluating the results of the larger program?
So I think that's a question for Blue Shield.
Sorry, Richard.
We'll take that under advisement.
Okay.
We don't get to advise you.
Dion, you always do.
Okay, so I think it was Lewis, Kate, and Lakeman.
So before we get too far into the conversation on DV Housing First, I'd like to kind of back up and kind of set the table of the environment in which we're operating, trying to help house individuals that we serve, because I think that's really important, especially for the commission to understand what we're doing and how things are either working or aren't working right now. So I can speak for Kern County, if please, my colleagues, please chime in on how it's different for you. But right now, the federal mandate has been towards a housing first policy, which has then created prioritization or creating where they would like to specifically invest funding for housing. It has typically been focused towards chronically homeless individuals that are also disabled. That is not the typical person that we engage through our services. And so in order to qualify for services, there now is a requirement throughout the country for something called a coordinated entry system. So everybody gets put into it, they all get evaluated, and they get a score. Then they go in line by that score. Their place in line can change from week to week depending upon inflow.
Day to day.
So, right, day to day. And so depending upon what resources come available, the people we serve for the new homeless dollars are not typically getting access to those. They're staying with primarily the chronically homeless individuals. And so it is very difficult to find housing solutions for individuals through the way the system is set up right now federally, which the state has followed suit in a lot of the way that they have expectations of those contracts. And so it has continued to compound that problem. That's why, so here's the environment, and this is a very different way of housing people. And I'll tell you very honestly, I didn't read the report until yesterday morning on my 5-hour Amtrak train, and the outcomes so far are amazing, what you guys are getting done. And I've been talking to everybody about it since. We can't replicate those in our rapid rehousing program for the general homeless population, right? Those things aren't happening. But that's just my 2 cents. I wanted to make sure that you guys understood the environment.
Louis,
Yes.
just real quickly, follow-up question on that. The model for, that you just described, is that placement of folks into homes, or does that address people that could lose their homes in some respects, or is it just placement?
So for Housing First, again, the requirement typically is being chronically homeless, which means you've been homeless for more than a year or had multiple episodes of homeless over the last 2 years. And so prevention, although again, people are beginning to talk about it, is not a priority. That was definitely one of the things, I believe in the report, it stated that 46% of the people engaged were able to stay in their own home. That is ridiculous, right? That just doesn't happen. And so I was very impressed by that. Prevention is something that I believe the field is trying to move towards. For the general homeless population, there is still some difficulty in coming up with a metric to accurately measure need, right? So that you can, again, prioritize. But for the people that we serve, that's a completely different conversation. That's not what we need to measure.
Okay, I think if I have the order correctly, Kate, was your light on?
Yasi.
Oh, Yasi, sorry. Was your light on and then it went off? Okay, so it's gonna be Yasi and then it will be Lakin. Then, I think that's Aaron's light on down there?
Yeah.
Okay, and then, I don't know if it's Anastasia or.
yeah, it's me.
Okay, awesome.
I just also want to highlight that the prevention of homelessness also means you're saving dollars on the cost of trauma on children. You're also saving dollars on the cost of unemployment that may happen for individuals who, because of relocation. It's the whole cascade effect that is being prevented when people can stay in their homes. That is also dollars that come from the state, and so I think if the state can prioritize this, it would be of great benefit. And I'm sure that if there's continued and longevity of the research, you would be able to see those other dollars that also then become unspent, as in response to the issue versus being able to prevent it from happening in the first place.
So, Lakeen with Haven Women's Center. One of the things I did want to touch on is like the quality and the quantity of services that we provide. So, during the year, one of our housing advocates will probably meet with 25 clients. But the number of times that advocate makes contact with those 25 clients is probably around 250 times. And that just goes to show like the level of case management and the level of work that both the advocate is putting in as well as the client in their setting their own goals and working towards those goals with the housing advocate. And then being able to accomplish those goals because of Housing First, because of the flexibility that this funding provides, we can now support clients in the goals that they want to achieve. We can now empower them to take, the lead. And without this flexible funding, it would just be so restrictive that we wouldn't be able to empower them in that way.
And I want to add to that with what Louis was saying about the context of this. When we were applying through our local housing collaboratives for additional funds to help support the work that's being done, Joaquin, in defending the grant application before the committee, was constantly peppered with, but how many people are you reaching? But how many people are you reaching? The fact that he didn't have the types of numbers that maybe Salvation Army or some of those other broader homeless programs had was really a strike against us. And I know there's question around how are agencies accessing their local funds. That's one of the issues that we face. We don't have the numbers that emergency housing providers do.
Do you have a follow-up to his comment? No, just add. Oh, okay.
I have a follow-up.
Oh, okay. Let's go.
My name's Annie. I'm from SAVE. On the flip side of that, our agency chose the broader spectrum for clients. So over the last year and a half, we've served over 150 clients, and some one time, 2 times, some for a year, and everything in between. And that time that all of our clients take in Housing First, setting goals, learning valuable skills, where I started a system where we would do workshops once a month, and they started out being financial workshops because our clients don't know how to budget. They don't know how to keep their money, pay bills, be accountable for their own funds. Soon became life building skills, setting goals. How do we do that? How do we track that? How do we keep on track? And that continual money dialogue on how important it is, but all of that takes so much time. And for a long period, I was the only case manager. Now there are 2, and now we're looking to hire on another person. And even still, thinking of the model that we've used to be able to capture as many families as we can and support them with the flexibility of these funds, which is amazing, but also realizing we are human, we have to have a life outside of our work, and how do we keep that balance of being able to support as many people as we can, but also maintain that level of really being able to case manage and guide and take those steps is a balance that's been really challenging, and that we're trying to figure out a better way to handle moving forward. But the flexibility of these funds has been incredible for our families. And like we talked about all morning long, like there's not enough funds. And if we had enough funds, we could help another 150 families easily.
Okay, so it's going to be Erin, Anastasia, Nilda, Orchid, then Inger.
I just have 2 other framing points that I think are important. Louis was talking about the chronically homeless piece that came out of, those are HUD regulations. The other thing, there are two other things I think to know about the HUD regulations. One is that they were designed at a point when we had far less situational homelessness than we do now. Like the nature of homelessness has drastically changed. So we're working from outdated priorities, and the state does not have to replicate those. Those are HUD's rules. The state can look at things differently. And then the second piece is that in the HUD paradigm, domestic violence is considered a special population, like foster youth or veterans. And unlike foster youth or veterans, how domestic violence interacts with homelessness is it's a core issue of homelessness. So looking at it as a special population, I think, leads to bad funding decisions, because it's like, oh, we're just going to carve off some domestic violence over there. It's a core reason that homelessness happens. And so I think we have to reframe, especially now that we have this opportunity of the state allocating so many dollars and not having to be inside of that old HUD framework. We have to reframe it and look at domestic violence issues as core to working on homelessness.
Yeah, sorry to take us back just a smidge back a little bit to what Lewis was saying about coordinated entry and some of the impacts there as well, and how the flexible funding really mitigates some of those. But coordinated entry for survivors of intimate partner violence can be an incredibly scary thing to even think about putting your name in. I know, and I can speak to in our small community, it could be possible that the person doing the VI SPDAT, which gets you your score, is related to the person causing harm. I mean, that's how small of a community we are, and I know I'm not unique in that way, but just to kind of put that perspective out there, that it could be a real threat to somebody. Second of all, we were talking about priorities, and yes, the HUD priority of chronically homeless and disabled being an issue, and then on top of that, COCs put on priorities as well, so they know the mandate of the HUD one, and then we get into real tough discussions and outright wars about, no, my population is more special than your population, right? So that also is an issue. And I know, and it's come up on regional phone calls, and our policy committee has talked about this, we're even getting, and this intersects a little bit with, and I think Erin has the right approach. It was such an aha moment for me when you were talking about it. We're so often working, trying to get the issue of domestic violence seen as a homeless issue. And I think that whole reframing of it, talking about, no, it is a core, is really going to do us good. But we have to get people to understand that it is the core.
Nilda Valmore, it's my sister's house. I know many of the folks around this table already know this, but just a reminder that immigrant survivors often don't want to go to a mainstream shelter, so that prevention, that flexibility of funds is really important. We also, oftentimes, immigrants don't get counted in the local homeless systems. They're not accessing those homeless services, but they do exist. It's kind of analogous to, I think, trafficked survivors that walk the streets. There are many traffic victims. They're not all walking the streets, so they're there.
So at Asian Women Shelter, we're in our second year right now ever of administering Housing First funds. Just to share a bit of our experience with it, most of our clients have not, our Housing First clients have not stayed in their home. Most of them, not all, but close, most of them have not felt that just their circumstances, they have not felt that was an actual safe option, given the domestic violence situation and family setups. So most of them we've been using Housing First funds to try to do kind of sustainable rapid rehousing in San Francisco. Ha 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 ha. And so I would say a couple of things to reiterate. I really support funding to support us to do evaluation, because the data the connections that we have with people, they're deep, and these people are not talking to anybody else. And I feel so confident about the impact stories that we could get out if we had the support to have the time and the expertise to do it, the sort of coordination to do it. Then the other thing I would say about our Housing First experience is that I think that what we see, and I don't think this is unique in the room, is that, well, you can think for yourself. So think of the things you've got. Like, if you're a citizen, lucky you. Work permit, super awesome. Education, many people here we've had some. It can show up on paper. We have all the sort of tools to advance ourselves. And you can think of, like, for yourself, how much could you advance your income in 2 years? You yourself now, with everything, with a whole page of checked boxes that most of the people that we work with don't have. Those check boxes are empty. So I think this first stage of violence prevention, homelessness prevention, is Housing First. We love it, we need it, we want it. Low barrier entry into housing, all the things. The second stage then is, and not just in San Francisco, but obviously definitely in San Francisco, the second stage is all of the side-by-side sort of economic job development, workforce development work that is really needed for the longitudinal success of Housing First. For people who are not temporarily poor, for people who are, as other people have said, intergenerationally in poverty, who, you know, as well as people we work with who were literally surgeons before they came here, but they're just in a totally different position and have to start from the very bottom all over again, sometimes for the second time. So that side-by-side support of the economic development is as much of the casework now as some of the early domestic violence work that was really in, like, core brute survivor-centered well-being, peer counseling, et cetera. Now it's brute economic work. And I think that is crucial. It's exciting. We've helped, you know, senior women get their first job ever. People who were absolutely not raised with the idea that they're gonna be a head of household or be a high earner ever, even if they managed their entire previous household's income. They managed stuff they had no control over. So anyway, I want to put in a plug for evaluation. I want to put in a plug for telling this full story of these multiple stages of violence and homelessness prevention, so that the success in your new place or in the place you were able to stay in can really, really continue unbroken and maybe even grow.
If you can all, as you go through this and talk about what's going on, talk about the concern of privacy. Anastasia touched on it, and that is so important. And for Lewis, where you're putting in all this data to get on a list that you then never get to the top. Oh, I'm sorry. So I just think it's pervasive, and it's probably a smaller piece, but maybe something that we could address. And so to the extent that you're all dealing with that problem, if you could talk about it, maybe it isn't as much of a problem as I think it is, but certainly Anastasia touched on it, and it seems like maybe something we can address in our report. So thank you.
Okay, so Orca's going to respond, and then we'll go to Amy.
Yeah, so I mean, definitely, so this is speaking to coordinated entry, speaking to data, speaking to who's going to be doing the various levels of the steps that have access to your data. So for us, we've had the exact same situation where the people that we work with mostly are terrified of coordinated entry, and when we go with them, they do not qualify, they cannot move forward in that system. So then what changed, though, was we kept saying, many of us kept saying, you know, HUD, this isn't working. So we can't use your HMIS, we can't use your system, it's not secure, the risks are too high, we can't, you know, and to our city and county, we can't do your coordinated entry. This is harmful because now there's a barrier between us and the interpersonal relationship we had with a program. We can't go to that program, we have to go through something that people don't want, some people don't want. And so then they changed it. So this last year, the DV bonus funds, the HUD DV bonus funds said, okay, you don't have to use the system anymore. So if you do if you have DV bonus funds, you would, so in San Francisco, which has now been provisionally awarded, whatever that means. I don't know how long it's going to take. But there's a project to try to develop DV-specific coordinated entry separate from the regular coordinated entry system. So that hasn't been developed. We'll see what happens. But then DV data doesn't have to go into that larger system anymore. If you have your own closed comparable database, you can submit aggregate data in that way. So there is a very recent shift due to so many people here saying what was wrong. I don't know how that's playing out in other counties, and I don't know how it will play out in ours.
So we did that. We applied to HUD, and we're just implementing a database that should be able to do that. But that database can change because we had a comparable database before that, and and then they did an upgrade, and we were no longer had a comparable database. Yeah. So then we applied for this round of funds, and I don't want to keep chasing it. That's just a lot of work. Database is a lot of work.
Yeah, I'll just speak to that too. So in Los Angeles, we're looking at a comparable database where survivor information does not go into HMIS, but there is a system by which survivors get in line for permanent housing. But I think on the other piece of all this data, there's been this huge push for information sharing. I think really thinking about the chronically homeless, the people on the streets who have severe health issues, but like the state TASIS multidisciplinary team thing about a year and a half ago that allows for different professionals to share information about a specific homeless person. So the DV field really fought against that. We did get a provision in there that we would, I would always ask for consent. But I think that so that is some of the tension between kind of our field and the homeless service field is we don't share information as readily because of the severity and the dangerousness of the people that we serve. So, and plus, I think it's just good practice to try and get people's consent. Yes. And I think that specific multidisciplinary team thing really is for about 1 to 3% of the homeless population, but they're applying it to everything. And so I think that's another big issue in terms of data sharing.
Okay, so it'll be Inger, then Yasi, then is it Lakin or May? May and Lakin, I'm sorry for butchering your name earlier. Okay, and then there's a light that went on down there. Perfect. And then there's someone over here. Jeannie. Thank you.
And this time Yasi is Kate.
What?
And this time Yasi is Kate.
Okay. And then Krista. Okay, Inger.
What I wanted to address is with the flexible funds, I came in like a month and a half when that funding became available, and with the overwhelming thing of taking over the agency. But since then, with the COCs and all that, in San Bernardino County, this year they're looking at helping the DV agencies with that funding. But prior to that, it didn't feel right for what our agency was doing for that Housing First, knowing that the homeless shelter and other things were really vying for that money at the time. This has all increased. But what I can tell you between what the county services are doing, what the COC is doing, all of that, we're seeing a real difference in the shelter and the change in who is coming in. So the people that are coming into the shelter are actually people that don't have a lot of support system to them, and they're needing those supportive services and they're getting to the programs as opposed to a lot of transient people that wouldn't have been transient had they not had these other supportive systems around them. Because we have a lot of groups that assist each other in making sure the housing is happening. So that's been an amazing thing to see just in the time that I've been there, that with the Housing First surrounding everywhere, there is a real difference in who comes into our shelter.
Can you reintroduce yourself and your organization?
I'm sorry. Inga Robertson from A Better Way, and we're from the Victor Valley and Victorville specifically.
Terrific, thank you.
Thank you.
What did I want to say? I think I wanted to echo, well, what everybody's saying about CES. I don't know that we need to go that much deeper. It's a mess. I think, you know, one way to sum it up in our county, in my experience, is it was kind of like, oh, whoops, DV, we probably should think about that. And now 2-3 years in, more than 3 years in, we are finally thinking about it, and it's still extraordinarily messy and not super helpful to the survivors that we work with. So that's my bit on CES. But I wanted to echo a lot of what Orchid was saying. You know, what we're experiencing with the Housing First is, you know, almost like this affirmation of a thing I've known for a long time, which is that survivors need a lot of time. There is no, you know, we actually ended up removing ourselves from a HUD-funded collaborative that we were part of, McKinney Linkages, if any of you are familiar with that. That was providing housing for, first it was up to 2 years, and then they shortened it to a year, and the idea was that people would, in that time, increase their self-sufficiency such that they could take over a market rate apartment after subsidy ended. And
on a target salary.
Yeah, on a minimum wage salary, which is not possible in the Bay Area. It's not possible. It's not possible in California. And so we actually gave up that money this year. We walked away from it because we were setting people up for failure. And it just got to be painful, you know. And we had, I don't know that we would have done it had we not had the Housing First money, but it was just kind of this obvious, like, why are we still tinkering around with this, what was $39,000 that didn't even pay.
A significant amount of meticulous
It was costing us
record-keeping,
money
yeah.
to have that contract. So we put everything into the Housing First basket. But I really want, if you walk out of here with one thing for me, I really want to impress upon you that where I'm at now is people need 5 years. People need a minimum of 5 years from the time that they come to us and engage in services, and maybe they're waiting on a U visa, or they've never ever worked, or they have a horrible housing history that needs to be rebuilt and reworked. We're talking 5 years. I mean, it may not be paying all of their rent for 5 years, but people need substantial amounts of time to get themselves together and their children together. And just, you know, this opportunity with Housing First is the first time we've been able to kind of start to kind of think on those timelines. I mean, there is no guarantee right now we're going to have that money that long, but we're looking at, you know, putting people through vocational programs. We've got a cooperative relationship with an organization called Rising Sun, which puts women through trades programs so they can get construction jobs. So we've got 2-3 clients who are, you know, on track to have $25 an hour jobs, so maybe they actually could pay Bay Area rent. And I just, you know, that's the lens we're looking at really all of our programs through now. You know, we're not looking at 6 months of counseling. It's counseling as long as you need the counseling, because it takes a long time to recover. And so I think, you know, the more that we can kind of build in those pieces of understanding that, you know, people need real job training, people need, you know, long-term solutions, the better off we'll be.
So to the question of safety and coordinated entry systems, it's important to remember that people who use violence in their lives are also people who in their jobs have access to those systems from an administrative level. And, you know, before we had housing funds, before there was talk of coordinated entry, we heard those stories in our clients just from the HMIS system. You know, client saying that her, and then they become part of the threats. So client whose abuser did have access to HMIS in another county telling her, no matter where you go, I'll find you. I can track you anywhere. And while there are mechanisms in place to report that type of abuse, she wasn't going to trust those mechanisms with her safety. The gamble was too high. So for her, safety planning became finding service providers we could refer her to that were off the grid as far as HUD funding was concerned. So, you know, and I really want to point that out because it's not just an issue of do people feel comfortable giving that information. It really is a core issue of safety that I don't think HUD has spent enough time addressing.
Well, I just wanted to mention regarding the discussion about the 5-year that Kate was bringing up, because it rang a bell for me. We also, at the same time, I think the commission, at least we want to include in something around the fact that we need CalWorks to be go back to 5 years for adults as well, right? Because that's a way of having some income, right? Something, right? Let alone Medi-Cal and all of that comes with it. And so it would seem to me that that's something, it's a place for us to have a juncture with making a recommendation to the legislature about going back to 5 years for CalWorks.
So I was just going to add to what May was saying. Definitely safety is a big concern when it comes to collecting data and collecting information, especially like in Orange County, the COC is getting an increased number of requests to release identifiable information to do research with, and the COC owns the data, right? And so they could freely share that. And so there is that definite concern. The flip side to that, though, is that if they're not collecting any aggregate information about domestic violence, then domestic violence gets sidelined consistently in the conversation. And so there has to be a way to make sure that that we're not allowing for it to get sidelined. So essentially, that each county has to represent what is the issue of domestic violence and how are you addressing it in the homeless continuum, and that seems to be lacking. I've been in a number of conversations, not just homelessness, but every single time there's an opportunity to improve the health of communities and families, domestic violence gets sidelined because of safety concerns and because that's a separate thing because there's safety rather than how do we deal with the safety concerns of this population to get the necessary services. And so somehow flipping it where we're actually addressing safety first as just the right thing to do, whether you're homeless and not a domestic violence victim, the fact that just because you're in need, your information can be shared for research without your consent shouldn't be okay even for anybody who's not a victim. And so really beginning to centralize how do we talk about people's information and safety and all of those pieces first so that all of these special populations or special issues that are much more complex don't get sidelined consistently.
I think Krista had a follow-up to the answer.
I can jump in after Jeannie.
Yes.
Are you sure? Well, actually, Marcella, that's a great segue to what I wanted to point out, and that is that DV is really underrepresented. So for the commission, when you look at HUD statistics, it is so underrepresented because, for a lot of reasons, but because primarily DV organizations have not been that involved in COCs before. We happen to actually coordinate our COC, and HUD told us we were the only one in the nation, the only victim organization that was leading a COC. And so how that can impact the counts is really amazing, because if you look at the statistics of the counts, in tiny Tehama County, 43% of our homeless people are victims of domestic violence, compared to the state average is 11%. And we think that that's because over the last 5 years, we've changed how we ask the question. So instead of the question being, are you a victim of domestic violence? Most people are going to say no. And first of all, also, as you mentioned, Marcel, there's a safety factor there too, and a what do you need to know kind of thing for. So we ask the question, have you ever been abused by a spouse or dating partner? That's something that is more accurate. People are willing to say it, and it actually gets at the truth of what it is. And so just knowing for the commission that even the numbers you get from HUD are so skewed and so unreliable when it comes to domestic violence.
Hey, Krista, and then I'm sorry, I
Oh, I don't know. Because I was going to address the count too.
Yeah. Well, hopefully this won't take you too off track. I would say the piece I wanted to chime in about that I think folks are raising is really comes into play around the data. And so just to be really clear, like the federal confidentiality under the Violence Against Women Act prohibits DV programs from putting client level information into HMIS, which is the Homeless Management Information Database. And this is not news. I think it was in VAWA 94. If not, it was in VAWA 2000, VAWA 94. Yeah, this is not new. It's not new to HUD. It's not new to a single like homeless continuum of care. And yet, the battle over information and client level information has been going on in communities across the country ever since, and it continues. And so I think like when we talk about, and you hear folks talk about how all of the new homelessness money, for example, that the state is putting in is great and needed genuinely, but is not going to hit DV programs, it's because of like, well, you all can tell me when I'm wrong. It's because of all of this, right? Like the local level dynamics, the way that the COCs broadly feel about DV and are annoyed that we won't give them data and don't play nice and ask for what they see as separate rules, like all of that impacts who gets money. And so I think like there's both the structural pieces. It's why we are thinking very explicitly about requiring in the state budget that a certain percentage has to go to DV because we know it won't otherwise. But I just want to name like all of this is both like the frustrations of a database, but also the reality of like why this intersection is so hard to change and why we keep going DV.
Right.
Well, that too.
It's called the patriarchy. But so I just wanted to share that in Los Angeles County, the people in our homeless count, the point in time count every year, the adults, 46% have experienced DV across their lifetime. I think 6% are currently fleeing. We know those are underreported numbers. In contrast, 30% of homeless population are dealing with mental health issues, 27% with substance abuse issues. We put so much emphasis, and I'm not saying we shouldn't, vets 9%. We give so much attention to vets and then with mental health and substance use, it's because that's who we see on our streets. And so it's easier to say, well, we don't really see domestic violence, but conversely, survivors are hiding. You know, that's their survival is to hide. So you have 46% of a homeless population, and you're not allocating any specific funding other than what may come through the DV bonus. Like, it just feels like something's really wrong here. I do feel like it's a patriarchy, you know, but just why do we continue to ignore this? And so I think if the state could take the lead in saying, hey, COCs, based on your point in time data, you need to have an adequate response to supporting survivors who are experiencing homelessness or housing instability. And I get really passionate about this, so I got a little work done.
So I'm from LA.
Okay.
And, you know, I'm watching from, I'm sorry, I keep forgetting the mic, I can hear myself well. So, you know, the mayor's working on these bridge homes. And actually, the Port of Los Angeles has now turned over, so that's where I work, and the Port of Los Angeles has now turned over some property for one of these bridge homes in Wilmington. And for anyone who's not aware, in Los Angeles, these bridge homes are the mayor's concept of putting people up and bridging the gap to move them into another location. Not once have I heard anybody mention domestic violence associated with this. I mean, there's talk of making sure that your puppy dog, which is important, can go with you, but never, ever about safety or anything. Are you guys even at the table?
Yes, so we're part of the Provider Alliance to End Homelessness, and I chair the DV caucus. We're also part of the DV Homeless Services Coalition, so Rainbow co-leads that coalition with the Downtown Women's Center. And we have spoken with the mayor and other city leaders about, our recommendation is that there needs to be a proportional amount for women and survivors, because not all survivors are women. So we need to have at least one bridge home that's safe. And, you know, we kind of get the, yeah, that's a great idea, but nothing ever happens. I mean, even just a proportion of bridge home sites that have beds for females or even for families. I think there's maybe one bridge home across LA City, and there's 14 or 15 different council districts.
one in every council district.
Right, and, you know, San Pedro, Wilmington, there's gonna be 3. There's one in Watts, one in Wilmington, one planned for San Pedro, but they're all like kind of half, it's for singles. So, again, that's who you see on the streets. If you're a family, likely they're in a car somewhere trying to hide, trying to stay safe. But we really keep advocating for more attention to be paid or to have some sort of proportional share of shelter beds specific to survivors, families, individuals.
I'm encouraged to hear that you're at least at the table, but it's, so there's quite a bit more, obviously, to do, but, yeah. I mean,
will be out of a job soon.
right.
Okay,
Thank you.
This is the order I have. I have Aaron, I have Lydia, I have Nilda, I have someone whose light went on and then went off, and then I have Lewis, and then I have Maricela. Whoever I lost.
Karen.
You've got Karen.
Okay, Aaron.
I just really briefly want to name something that hasn't been named in the room yet, but the rates of sexual violence, domestic violence, and the amount of survival sex and sex exploitation that happens to not just women who are homeless, but women-identified folks, trans folks, et cetera. And that is so far from being part of the conversation. When we've tried to raise it in Oakland, one of our policy attorney raised it at a city council meeting, and a city council staff person screamed at her after her public comment that she dare not, bring those issues up. But so, I mean, it's a 360 problem. It's not just domestic violence going into homelessness. The risk is exponential once they're actually unhoused.
Yes, I just wanted to say that Co-op doesn't receive Housing First funding, but we are fortunate to work with shelters that do receive that funding. And for us, the community that we serve, it's really important to have that flexible funding, especially because a lot of the participants, the survivors that we see, can't get into homeless shelters, and especially can't get into DV shelters. Because of the binary of being having to choose between male or female. A lot of the folks are gender nonconforming or trans women that face a lot of discrimination, not just by other like other survivors in the shelters, but also by staff. And so for us, it's really important to continue bringing this up and to continue advocating for Housing First funding. Because it is really important for especially trans women of color who have high rates of unemployment and are chronically homeless, for that funding to be a multi-year funding. So I definitely agree with like it taking 5 years to get someone stable.
Sorry, thank you. So I want to connect the morning part with this part, and some may disagree with me. But basically, if there's a takeaway, I think, from the last 20-plus minutes, that our homeless field and our DV field are very different fields, culturally very different fields. The morning part, there was a question raised of who should, if it's not Cal OES, where should the funds go? And I think that the funds, I don't know where the funds should go, but I think that they definitely should not go with a homeless field or a housing field, because then I think that will just screw things up even more. And I actually Cal OES may not be perfect, but they've at least their heart's in the right place. And that's it. Thanks.
I think a lot of attention needs to be paid to the definition of homelessness. and the intersection of domestic violence and homelessness. Recently, Genesee staff had a meeting with the head of Housing Community Investment Department in Los Angeles, and he's a really great guy. And just during the meeting, told us he didn't know that people who came to our program were homeless. Yeah, and here's somebody who's in charge and in all the rooms and the policy. So I think that's something that all of us can help people understand that folk are homeless because of domestic violence, and that's why they come to the shelter. And then one of the key supervisors in Los Angeles County, who is a huge supporter of DV programs, but he also is supportive of ending homelessness. Still, he doesn't get the connection either. So, what is our strategy as a team to change that?
Just speaking to in LA, they're calling them bridge houses? Yeah, so bridge homes, navigation centers, low barrier shelters, they're dropping a lot of different names on them throughout the state. They're all addressing, as you said, how do you deal with puppies, right? So it's the 3 Ps, partners, pets, possessions are the things that you've got to deal with. We are relocating our entire homeless campus, and so we've traveled through Texas and California looking at new facilities, specifically talking to low barrier shelters about how are they able to work out the partners? And what we found in our research was the number one reason people are exiting after they've come in as partners is because of domestic violence. And the staff are not trained or prepared to deal with those crises in their facilities. So I just thought it was pertinent to your comment.
For example, the unit that is going up in Wilmington will be run by U.S. vets. So to your point where people are focusing on veterans, and then you said it was 9% of the population, this is going to be probably a non-PC comment, but it is so much a political issue of who is getting the money, and the voters as well, the people who are living there who don't want these people on the streets. There's a fear of somebody who's on the street with a mental illness. There is a fear of somebody who's on the street with a drug addiction because they are sometimes going to, speak to someone who is not unhoused, unsheltered, and they're afraid. So then there's this push to get those people sheltered. Mostly, I think, particularly for what I'm reading in the papers in San Pedro, they don't want to see them. And so as Elizabeth is pointing out, that the people, the community that you're serving is actually in hiding. So the political, structure is not addressing that because there's not that political cry to help these people because there's not that fear. And so, and again, I recognize this is not maybe the most politically sensitive thing to be saying, but I think it's the reality that, everybody is like, the homeless crisis is because those who are sheltered don't want to see these people on the street anymore. And the people that you're serving, for the most part, are protecting themselves in a different way. They still need the services, but we're not seeing them, so.
And
anyway.
Just quickly to follow that, mental illness, chemical dependency, expressing itself in public can really make people uncomfortable. And they react fearfully and negatively. We take great pains to protect the people that we serve. I would argue, because of that, we have also harmed our programs overall. We're doing the right thing by the people that we serve, but the scope and scale of the crisis is not known.
Yeah.
And we are partially creating that lack of knowledge.
And again, because of the other things, the privacy needs that we talked about and all of that's all come out today to sort of explain all of these things. But yeah, I think there's a myriad reasons why the community we're focused on today is being underserved to the need.
Yeah. And I would add, right, that part of that is still the stigma around victims, and victims often get blamed for their situation, right? So why they're staying is their fault, why they don't get housed is their fault. And so I think there's still that needs to be addressed on a larger scale. And I also didn't want to lose in this conversation the importance of prevention, because what I again, going back to Orange County is not eligible for prevention dollars for prevention of homelessness until they get stronger in their actual intervention, which is almost a backwards way of thinking about it, right? And so I would say that some of the ability and based on the research, not just that Elizabeth has seen, but some of the things that we've seen too, is if we could prevent people that are victims of domestic violence from becoming homeless in the first place, it's a worthy investment, and perhaps earmarking or prioritizing some of those prevention dollars and putting it that way, right? And how we're saving money and how you can put somebody on a path to self-sufficiency much quicker in their own homes might be a way to actually have that conversation on why it's important versus we're competing, right? The veterans aren't going to be blamed for being homeless, right? That's not the way it's going to happen. But there are many more victims that aren't coming forward because they are concerned about being homeless.
Okay, so Yasi and then Michelle or Angela.
I just wanted to point out a couple of things. NIMBYism is absolutely the reason this looks the way that it does. There's no reason to pretend that it isn't. Most domestic violence survivors, the number one reason people are on disability is because of a diagnosis of anxiety or depression, PTSD. Most of the people we serve meet the diagnostic criteria for that diagnosis. Many of the people we serve, utilize substances as a way for coping with the lives that they've experienced. Those things all then get translated into the care of children. And none of that stuff shows up because it's hiding in other places. Protective parents are finding other ways to make sure that their children don't sleep on a street, and coming up with a whole myriad of ways of making sure that they are under some kind of a roof, if that means the selling of your body or whatever it may be. So I think that once again, this definition of chronicity and disability, again, are more about NIMBYism and not because the people that we serve don't actually meet those criteria. So these are just irrelevant words. And the bottom line is, do you live in an address that is your own? Yes, no. And then start from there. And absolutely, I love the idea of start with safety first. Safety should be for everyone, not for one community of people. And also, I think it's really frustrating, disheartening that when people are advocating for the safety of people who've experienced a crime done to them, that's seen as being combative or non-cooperative is a really, really sad starting point. So there have to be opportunities to think about, why not think about safety for everyone? And then lastly, the comment about the reason for families often being expelled from what are homeless shelters, oftentimes it's the survivor who ends up having to leave. And so that's the other, or both. And so it's just rife with issues that I think really opportunities like this may be the starting point for changing it.
I'm going to, going to go in a slightly different direction. Again, I want to talk about frontier rural. Plumas County is 90% federally owned property. So right now, today, if we were to check in our building department, there may be one housing start. So it's the lack of inventory. And when you live in a community where a county where we're losing population, we're a recreation, to entice builders into the community when there are few privately owned places to build, present a huge problem. Now I can imagine, I feel for anybody living in San Francisco, absolutely. We're sort of in the same dilemma on the other end of the spectrum. This is where we have a commonality. So,
If I may, Santa Clara County doesn't have any different data. And they have just, as to what you mentioned, that because you do enter into the system, there's data. Santa Clara County has decided that half of the homeless facilities that they're going to be building are going to go to DV survivors. They didn't need the numbers. I'm just going to say that.
So I wanted to talk a little about prevention from the legal aspect by providing more legal services. I think one great way to prevent homelessness and keep folks in their home is not just, there's a lot of money going out there for eviction prevention, which is great, but more than just representation during the actual eviction case, but more full scale. So that includes appeals to get better case law to actually have the judges follow the good laws out there to protect survivors of domestic violence. Because there's no case law on there right now. Hopefully, we'll change that. Really make sure judges are following the law to get that there, and along with housing representation, also full scale for family law. I mean, including like domestic violence representation, especially in rural counties. There is very little to no legal services provided to survivors of domestic violence in issues related to domestic violence. This creates a problem when you're going to get restraining orders, but this also, if you're getting a divorce, so a dissolution, if you don't have an attorney to represent you, you're probably more likely to have your abuser get the home and then therefore become homeless. It's more than just, the emergency of going through the eviction process. There's a lot more to it. There's keeping, before an eviction happens, having an attorney to talk to your landlord, stopping things from going forward. After an eviction happens, having an attorney push for your rights to, not be discriminated because you're a domestic violence survivor getting into housing. Make sure your housing voucher isn't terminated because of domestic violence, or you can get into federally subsidized housing as a domestic violence survivor. There's so many barriers to survivors getting to housing that just having an attorney with you makes such a big difference. So just more funding for legal services is always well needed, especially focused on DV.
Someone brought up children and children's protective services, so I just wanted to expand on that. I think one of the biggest barriers that we're seeing for survivors is when they're forced to go to shelter, being threatened with detention of their children, and even when they do get to shelter, their kids are detained, and then their benefits are reduced, and they're supposed to go out and find adequate housing before those kids can be returned. There's got to be a better way to support survivors who shouldn't be charged with failure to protect. They're doing the best that they can, and I just feel like we've gotten this really backwards where the survivors are held responsible for protecting their children, but the person who's harming them isn't. We need shelters for people who harm, not people who have to flee that harm, and it's just backwards. So I think that until we can get to a place where there's more understanding, and I know that in LA County, CPS does have housing dollars. They don't talk about it a lot. Like, you have to do a lot of advocacy to get to those housing dollars. So I think that that's a real big issue and a huge barrier that some survivors face.
It was me again. To piggyback on what Taylor said around legal services, and this is a recommendation for Cal OES of a small change that can make a big difference. The KL and XL grants are amazing to us to be able to provide services in a county of over 500,000 people that has no pro bono or low bono services for domestic violence except for a small smidge. Please, please, please lift the cap on consultant fees, because apparently that's where contracted attorneys live in the Cal OES world, and $85 an hour is finding attorneys who are willing to contract with what for them is a huge pay cut has been extremely problematic.
So that cap comes from the federal level. Sorry. A lot of our stuff does come from the federal level. I just wanted to say that, and I didn't say that earlier. I did want to say that. I mean, the Code of Federal Regulations is this big, and there's a lot of stuff that we have to abide by when we take those federal dollars, and then we have to ensure that everybody else abides by them. That 8125 is one of those things. 8125 an hour is $650 dollars within 8 hours. However, Cal OES does have a form where you can request to go above that 8125. That was another thing that my boss, Lee Bills, worked on this year. She advocates for us a lot and for you all a lot at the federal level and asks questions and pushes and say, can we do this? Can we go above it? What can we do? And a lot of times they do come back, and sometimes they come back and say, if you have a process in place where, you know, you're doing your due diligence to ensure that that's what they really need, we can do that. So we are able to go above that 8125 with a form that we now have in our agency that we implemented this past year.
Nilda has a direct
So
follow-up question.
is the 1.5% reimbursement rate for audits, is that from the feds too?
Yes, it is. And so what it is that for, if you see federal funds, they want you to do a single audit. And so they allow you 1.5% of the total funds that you receive in your grant to go towards paying for that audit.
I just wanted to highlight another aspect of invisibility and uncountedness in our populations, which is first, of course, we've talked about survivors who are with their kids in the car and not going to the homeless shelters, and I just want to add on top of that limited English proficient survivors and survivors who don't have citizenship in any way. It doesn't matter, documented, marginally documented, waiting for this process that's taking 2 to 3 times as long as it used to. And for us at Asian Women's Shelter, every year our LEP, limited English proficient population of clients is about 80 to 90% of the total. And I just want to say that's only like double what California is. Like California isn't 5% limited English proficient. It's a huge, but that's so unreflected in how these systems are set up, like not even close to reflective of our real estate population. And it's not just San Francisco, we all know. It's rural counties that are basically bilingual or almost, monolingual, or that are bilingual in Spanish and an indigenous Mexican or Central American or South American language. So I think when I think about Housing First, I think about the funds, I think about our budgets, I think about our, any work that's across language, whether that's American Sign Language or another kind of sign language or a spoken language related to national origin, that has to go in a budget. I mean, it's not going to break the bank, but it has to be in the bank. And I think we have a ways to go there. And I think that my experience with homeless systems is just 100% invisibility. And I think it is, even if you take the abuse part out, LEP communities aren't going to coordinated entry either. They're sleeping in the floor in a, corner of a commercial place where they're not allowed to sleep, but they're sleeping in there. They're sleeping in various places instead of going and being seen. So I just want to make sure they're named and that we know that that's part of a direct service budget. It's direct service, nothing else. Oh, I'm sorry, one other thing. And that I want to bring in again, where this is an area where I think our partnerships in these grants, whether it's DVAP or it's Housing First, where partnerships can open these doors that have been chronically shut, so that people have language access, not from someone who, raise your hand right now if you studied some sort of foreign language in middle school and or high school. Right. And if your life were breaking into pieces, could you reflect your experience in your middle school French? I was president of the French club, and no, I could not. Not a tiny little shred. And so the ways that people are assessing what survivors' language abilities are, someone having a good accent when they say a sentence in English does not mean that they can speak English. So we can partner with organizations, you know, and in respectful, paid ways to build those bridges and be able to have give the full understanding to the clients that we are able to work with this funding, regardless of their language.
I don't know if it was Jeannie or Anastasia who had the line on. I did, but I can't remember what it was right now. You can email me if you remember. Kate or Yas? Kate, okay.
I just have been having this thought, and Echo, Orchid kind of reminded me of it. I think one of the things that would be kind of cool, Chris, to look at over the long haul is what's the sort of impact we're having beyond our own agencies, like with these partnerships, and just thinking about the organization I mentioned with women in the trades. I think the women that we're supporting who are in that program would not have been successful in that program if we weren't supporting their housing while they're doing that program. And so I don't know
And
if
also
that's...
the mental health.
Huh?
And the other pieces that also need support.
Right. And so I just wonder if that's kind of like a long-term selling point somehow, that by, you know, giving us these housing dollars to work with so that we can help build stability for people, then when they're participating in vocational programs or, I mean, we already know once you stabilize families, then kids do better in school. I mean, there's that whole sort of like trickle-down effect, and it would be kind of cool if we could think of ways through these partnerships that we have to try to measure that somehow so that we can talk about the compounding impact of these kinds of funds.
Sorry, it's me again. And then this is just, and this is around the issue of language access and especially respectfully paying them. We had built up a way to do that. We had built up a program of 11 community members who collectively, I'm sorry, 13 community members who collectively spoke 11 languages that were Asian, South Asian, and Middle Eastern, which was something we did not have on staff. We used foundation money to pay them for their time. We use this as our language access plan, and the governor is on my list for this because when the independent contractors were reclassified, we lost all of them but one. He wiped out our language access program. Is it a flag issue for you? Yes, because all of these people were not professional translators. They were people who worked in schools and for the county and other things who said, I want to help, and the fact that you're going to give me money to do it really makes me want to help. Our program grew in ways it had never had when we were trying to just ask people to volunteer their time, and it's gone.
Okay, so thank you all for coming here. I know we've approached both of these topics from a really high level, but that's how we have to do it in order to keep things on track, unless you guys want to like camp out here for a week. But I do really appreciate it, and I will want to talk to each and every one of you more about the ideas you raised, so you'll be hearing from me. And if you have any ideas that you want to discuss, please reach out to me too. So this is just the beginning of the conversation, not the end. And I just can't thank you enough for volunteering your time and sharing your expertise with us. I know you guys are all out there doing wonderful work, and it really means a lot to us that you're making this time for us. If Ethan or Jana want to say anything before we conclude.
I will just echo what Crystal has said. On behalf of the entire Little Hoover Commission, the commissioners who are here with us today and those who couldn't be here but are still paying very close attention to what we are doing in this subcommittee in order to put together this report. Your insights in the field, what you have shared with us today, is invaluable to our being successful with our report and trying to provide recommendations to the governor, the legislature, which will help you do what you do and make it easier, more efficient, and rescue more people. We understand the important work that you're all doing. we can't thank you enough for what you are doing for these people and these victims, survivors. So me personally, and also on behalf of the entire Little Hoover Commission, our heart goes out to you, and we thank you for your time today and your continued work in the field in what is an incredibly difficult assignment. And, we appreciate it very much. So thank you.
I'll just say, on a lighthearted way to end, I will be in big trouble with our comms person if I don't try to get a picture of folks for social media. You all knew this was coming, partnership members. So anyone who is willing to do a quick group photo, I would love that. And thank you all. Thank you so much to the commission for hosting us.
Thank you.
Oh, sorry, just one more note. If there's still food on your way out, please take it. We've paid for it. So it would be great if someone ate it. Thanks.